If you're considering weight loss surgery, then you probably want to know if it's the best solution for you and what the pros and cons are. In this video, I'll share my insights into the process, how to know if it's right for you, and what you should be mindful of to ensure you get the best chances of long-term weight loss success. Let's go. Why do people choose weight loss surgery? Is it the easy way? Well, I admit I might be biased. I'm not a huge fan of weight loss surgery. While for some special cases, I get it, it might be the very best option. We see great success and overall better health outcomes in general when people drop weight without surgical intervention, which, by the way, is really risky. Bariatric surgery as a group has reported complication rates of up to 60%, and the failure rate is documented at surprisingly high, 51% at 3 years. Bariatric surgery, though, continues to increase in popularity due to published success rates, medical community support, and failure of traditional nutrition approaches for weight loss and maintenance. Also, it continues to be pretty darn popular because insurance often covers a high percentage of the cost. Unfortunately, what is less frequently touted are the huge complications and the metabolic implications, along with the failure rates for the long term. Several long-term clinical outcomes and meta-analysis studies have demonstrated concerning findings that put the success of bariatric surgery into question as a true safe choice for those struggling with obesity. I want you to understand the different types of weight loss surgery, so I'm going to go through the 4 most common that we see. Number 1 is the gastric sleeve, in which 80% of your stomach is removed and all that's left is a small sleeve. This basically reduces the amount of food that you can eat in one sitting, obviously, right? The second one is gastric bypass, and this one's pretty popular. It's where a small pouch is created within the stomach, and then the small intestine is divided in a way where a portion is reattached to this newly created small stomach pouch. This restricts how much food your stomach can hold, and it also reduces the amount of nutrition your small intestines can absorb. I don't know if you know this, but the small intestine is where you actually absorb the most of your nutrition. The third type of gastric surgery is called a gastric reduction duodenal switch. This combines the two that I just talked about, but allows the food you eat to bypass 75% of your small intestine. This is crazy because the small intestine, again, is where you absorb all of your nutrition. This type of surgery has a huge outcome of major nutritional deficiencies. It's very hard for your body to absorb enough nutrients with this type of surgery to stay healthy. And the last, 4th most common type of bypass surgery or weight loss surgery that we see is called the loop duodenal switch. It's similar to the one that I just talked about, but this time the small intestine is attached as a loop, and it allows a little bit more access to the small intestine so that we absorb a little bit more of the nutrition that you take in hopes that we experience less extreme nutritional deficiencies. So as you can see here, there are going to be some nutritional consequences from these types of surgery. My husband is a foot and ankle orthopedic surgeon, and he has a lot of experience with patients who underwent gastric bypass. And he found that they healed poorly and that they were at increased risk of complication and amputation. Most patients that he saw after bariatric surgery either gained all their weight back or they plateaued at an unacceptable weight, and they were pretty darn unhappy with their outcome. And my experience is actually really similar. I see a lot of people in our offices who did not have good outcomes as a result of bariatric surgery, and they came to me because they really wanted to see if there was something else out there that could allow them to actually drop this weight, maintain it, and help them overcome the nutritional deficiencies as a result of the surgery. My husband's experience and my experience actually has been echoed by many of our physician peers who often refuse to perform elective procedures on patients who have undergone bariatric surgery because of the nutritional deficiencies. And I think this is so wild. The deficiencies are actually really well documented in the literature, and it shows that there's a 64% rate of anemia at 3 years post-op and a 33% vitamin B12 deficiencies at 2 years post-op. And And oftentimes these deficiencies just can't be corrected, and it presents a huge, difficult challenge in caring for these patients because oftentimes they're unable to heal from the post-op wounds. I actually have a plastic surgeon who loves to treat any of our PhD clients. Maybe a client who's dropped significant weight and they want to have some skin removed. He loves our clients because they're nutritionally fed and really well nourished, and they heal extremely well. He refuses to operate on anyone who's undergone weight loss surgery because the wounds just don't heal, and he feels that it causes so much more harm than good. If you're considering weight loss surgery, or if you've already undergone weight loss surgery and it didn't have the outcomes you expected, click the link below and reach out to us because I know in my heart that we can help you see the goals that you want to achieve. So if you're considering weight loss surgery, I just really want you to consider 3 very important things. Then decide if you feel like it's the best route. Number 1 is that no matter what you do, your nutrition needs to shift. It's not just about eating less, and this is largely what weight loss surgery does. I see so many people who have regained the weight that they lost through surgery because there was no knowledge gained about what to actually eat. They simply eat the same things as before, just less of it. And over time, the stomach stretches, our old habits come back, more of these foods continue to come into play, and guess what? Regain happens, and it happens so quickly. The second thing that I want you to consider is that your body doesn't function well when it's nutritionally starved. Bariatric surgery is basically a process where the normal processes and the normal functioning of organs are disrupted. I think it's crazy if you think about it. For example, the stomach is manipulated so it doesn't absorb and digest food the way that it's supposed to. This often creates big deficiencies that are often impossible to overcome, just like I mentioned earlier. And the last thing I want you to remember and consider is that 80% of any life change, and yes, weight loss is a big qualifier, comes from your mind. In order to create sustainable change, we need to tackle the mind. Weight loss requires a mindset shift and significant work done on the mental, emotional, habit, behavior that impacts why we eat how we eat. So if this work isn't done, sustainable change just won't happen. For some very unique cases, bariatric surgery, I understand, might be the best option. However, I want you to strongly consider your decision if you're contemplating it. You can lose weight without surgical intervention. You can do it through the power of you, through the right foods, through the right nutrition education, and the right mindset. Outstanding and long-lasting healthy results will be your outcome. Whether you decide if weight loss surgery is the way to go or not, you'll have to make changes to your lifestyle. Without changing your behavior, the weight loss surgery will lose its effect over time and your body will go back to its previous state. In this video here, I'm going to share with you my tips so that you can make this shift already right now. This will make you much more prepared to maintain your ideal weight. See you there.